Hello, my name is Wayne Griffin, instructor for Assisted Living Training, brought to you by Assisted Living Nurse Care Services, LLC. In this lecture, we will be discussing dementia, mental health, and behavioral management, with a focus on an overview of dementia, effective communication, behavioral interventions, making activities meaningful, staff and family interactions, and managing staff stress. When completed, you will be able to recognize the symptoms of cognitive impairment, differentiate between irreversible and treatable dementias and their causes, cite methods for treating and managing cognitive impairment, showing understanding of and be able to use the Rydberg scale to identify the stages and progression of cognitive impairment. So let's begin our discussion. When we're talking about Alzheimer's disease, what we want to realize is that 90 years ago, only acted with this disease. But today, it is considered a major health issue. What has changed? For one thing, people are living longer. And the number one risk factor for this particular disease is age. This does not mean that Alzheimer's disease is a part of the normal aging process. But what it does mean is that as we age, we become at greater risk for acquiring this disease. In this discussion, we're going to look at the difference between Alzheimer's and dementia. In order to view the whole lecture, visit us at www.assistedlivingnurse.com under training. So let's answer the question, what is Alzheimer's disease and what is dementia? Alzheimer's is a disease. We know that this disease affects the brain. We also know that once it is acquired, it's not reversible, not yet, and it is progressive, which means that it gets worse. Alzheimer's is one disease that destroys the brain in a very specific way. And as it destroys the brain, it disrupts memory and thinking, as well as other functions. So what is dementia? Alzheimer's disease is the most common cause of dementia. What that's telling us is that dementia has a cause. Something caused the dementia. What it says is that if a person is over the age of 65 and they have dementia, the most probable cause is Alzheimer's disease. So in order to clarify what is dementia, let's look at a slightly different document, which we talked about in previous lectures, in the lecture on the assessment process. Let's look specifically at the healthcare practitioner physical assessment form. This is the healthcare practitioner physical assessment form as discussed in the previous lecture. When you look at this form, it shows the resident's name, date of birth, and the date that the form is completed. This is question number 10 out of 12 questions. It asks a question that says, is there evidence of dementia? Well, what is dementia? So let's just say yes. Has the resident undergone an evaluation for dementia? What is dementia? It goes on to say, what is the cause of the dementia? Is it a cause? As you can see, there are a few causes posted here. Is it Alzheimer's? Is the cause of multiple infarcts or vascular? Is it Parkinson's? And has the person undergone what's called a mini mental exam? So the question is, what is dementia? The word dementia means syndrome, or another way to look at it is means a group of symptoms. What are the symptoms? We're going to look at, on this document, we're going to look at 4 different areas. We're going to look at cognition, which means how a person thinks, communication, how do they communicate, We're going to look at their moods and emotions, and we're going to look at their behaviors. When we're talking about dementia, what they're asking on this form is, do you see any of the items listed here? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. Do you see any of these 11 items under item 10E? Do you see disorientation? Does the person not know person, place, time, or situation? Do they have impaired recall of recent events or distant events? What about impaired judgment? Hallucinations or delusions? Hallucinations, do they see things that are not there? Delusions, do they have any false beliefs in their minds? Receptive or expressive aphasia, difficult to receive and understand what's being said and difficult to express the words or thoughts that they have in their brain. What about anxiety? How do they feel? Is it depression that we're looking at? Do they practice unsafe behavior? Are they dangerous to self or others? Or do you see any form of agitation? When you're talking about a group of things that you see, they're asking you, do you see any of these symptoms being displayed by the resident? What I want you to do from now on, when you think of dementia, what you're asking yourself, do you see this group of symptoms? In general, you are going to see them in varying degrees depending on the stage of the person. What stage of Alzheimer's disease have they progressed to will determine the degree of which you see these symptoms. Which means you're not going to see just one symptom, you're going to see multiple symptoms in play at any given time. Because dementia means syndrome, and syndrome means group. If you have enjoyed this lecture up to this point, please visit us again at our website, www.assistedlivingnurse.com, and view the whole lecture.